The struggle with intimacy is often a silent one, hidden behind closed doors and masked by a brave face. But for many men reaching their 50s and 60s, the realization that their body no longer responds as it once did can be a devastating blow to their self-esteem. I have sat across from countless men in my clinic who feel as though they have lost a core part of their identity, often after a single frustrating night where a medication they relied on failed to deliver the promised results. Dear Emily Carter, and as a specialist physician who has dedicated my career to the nuances of male sexual health, I want you to know that you are not alone and, more importantly, that a perceived failure of treatment is rarely the end of the road. Many men believe that if a pill like Tadalafil does not work immediately or stops working over time, their body is simply broken beyond repair. However, the truth is often much more manageable and usually boils down to a misunderstanding of how these complex biochemical tools interact with an aging physiology. The lie that many men tell themselves is that the medication should work like a light switch, but in reality, it is more like a dimmer that requires the right environment, the right timing, and a clear understanding of the biological hurdles that come with age. When we look at the statistics, we see that nearly half of all men between 40 and 70 will face some form of erectile dysfunction, yet a significant portion of those men will give up on treatment because they feel the initial results were lackluster. This gap in success is often not due to the medication itself but due to subtle errors in how it is administered or a lack of patience with the body's shifting needs. Before you lose hope or decide that your best years are behind you, it is vital to understand that maximizing the effect of Tadalafil is a science that involves more than just swallowing a pill. Today we are going to embark on an essential journey of discovery together, peeling back the layers of medical myths to reveal the 5 proven strategies that can truly restore your confidence and change your life for the better. One of the most common reasons men feel their treatment is failing is a psychological phenomenon known as performance anxiety, which can physically override the biochemical benefits of the medication. When a man enters his later years, the pressure to perform can create a surge of adrenaline that constricts the very blood vessels Tadalafil is trying to open. If your mind is racing with the fear of failure, no amount of medication can easily bypass that neurological override. This is why the first few attempts with a new prescription can be inconsistent. I always tell my patients that the first dose is not a test they need to pass. It is a reintroduction of a natural process that their body needs to relearn. Tadalafil is a vasodilator, meaning its primary job is to relax the smooth muscles in the walls of the blood vessels to allow for increased flow. In an aging body, these vessels might be less elastic due to years of plaque buildup or naturally occurring changes in the endothelium. Therefore, the medication needs every possible advantage to work effectively. If you are taking the medication and then sitting in a state of high stress, watching the clock and waiting for something to happen, you are essentially fighting against the treatment. Furthermore, many men are unaware that erectile dysfunction is frequently a vascular issue first and foremost. If you are experiencing a decline in the effectiveness of your medication, it may be a signal from your body that your overall cardiovascular health needs attention. However, even for those with excellent health, the mechanics of how the pill is absorbed and processed by the liver can change as we age. We often see that men who have used Tadalafil successfully for years suddenly find it less potent, leading to the mistaken belief that they have developed a tolerance. In most clinical cases, it is not a tolerance to the drug itself, but rather a change in the user's routine or a decrease in the quality of the medication they are purchasing. The market is flooded with various versions of this drug, and not all are created equal. If you have switched to a generic brand that does not meet high manufacturing standards, you may only be receiving a fraction of the active ingredient you expect. This is why I emphasize the importance of using reliable, high-quality sources, whether you choose the brand name or a vetted generic alternative. As we move forward, we will look at how to properly time your dosage and what specific lifestyle habits might be acting as a physical barrier to your success. It is not just about the 20 milligrams you take. It is about what you eat, what you drink, and how you prepare your mind for the experience. We will explore the specific window of time where the drug reaches its peak concentration and why waiting an hour might not be enough for some men. By understanding these nuances, you can move away from the frustration of unpredictable results and toward a consistent, fulfilling, intimate life. This is a journey of reclaiming your vitality, And it starts with the knowledge that your body still has the potential for greatness if given the right support. Let us dive deeper into the vascular science and the hidden mistakes that might be holding you back from the results you deserve. To truly understand how to maximize the effects of Tadalafil, we must first look at the intricate plumbing of the human body, specifically how the vascular system evolves as we transition into our senior years. For men over 50, the process of achieving an erection is no longer just a simple reflex. It is a complex coordination of neurological signals and physical blood flow that must overcome the natural stiffening of the arteries. Tadalafil belongs to a class of drugs known as phosphodiesterase 5 inhibitors, or PDE5 inhibitors, which are essentially powerful vasodilators. Their primary mission is to relax the smooth muscles within the blood vessel walls, allowing a surge of blood to enter the penile tissues to create the firmness and rigidity necessary for sexual activity. However, as we age, our blood vessels can become less responsive to these chemical signals due to a lifetime of environmental factors, diet, and the natural decrease in nitric oxide production. This is why many men feel the medication is losing its touch, but often the issue is that the body requires a more strategic approach to assist the medication in doing its job. In the medical community, we often see that erectile dysfunction is one of the earliest clinical signs of broader cardiovascular health issues. Because the arteries in the male anatomy are significantly smaller than those leading to the heart, they act like a canary in a coal mine, showing signs of restricted flow long before a patient might feel chest pain or other symptoms. When you take a 20 mg dose of Tadalafil, you are essentially asking your body to widen these narrow channels. If there is significant plaque buildup or if the vessels are chronically constricted due to high stress or poor circulation, the medication has a much harder hill to climb. This is why I often discuss with my patients that the pill is not a magic fix that works in a vacuum. It is a partner to your vascular health. By improving your overall circulation through light exercise and heart-healthy habits, you are essentially paving the road so that when the Tadalafil enters your system, it can travel and act with far greater efficiency. It is also vital to address the concept of the erection cascade. In a younger man, this cascade might be triggered almost instantly, but for the middle-aged or elderly man, the chemical reaction takes longer to build momentum. Tadalafil works by blocking the enzyme that breaks down cyclic guanosine monophosphate, or CG. This CGMP is the substance responsible for keeping those smooth muscles relaxed and the blood flowing in. By keeping the CGMP levels high, Tadalafil maintains the erection. However, the body only produces CGMP when it receives a clear signal from the brain that it is time for intimacy. If the vascular system is sluggish, that initial signal needs to be stronger and more sustained. Many men make the mistake of thinking that once the pill is in their bloodstream, the biology should take care of itself, but they are missing the crucial step of supporting their own internal chemistry through relaxation and focused stimulation. We must also consider the role of comorbidities that are common in our demographic, such as hypertension or diabetes. These conditions can damage the delicate lining of the blood vessels, known as the endothelium. A healthy endothelium is essential for the vasodilation process that Tadalafil facilitates. If you find that your medication is not working as well as it used to, it might not be that you have developed a resistance to the drug, but rather that your underlying vascular health has shifted. This is why consistency in your overall health regimen is just as important as the timing of the dose itself. When we combine the pharmacological power of a high-quality PDE5 inhibitor with a body that is primed for blood flow, the results are significantly more reliable. Furthermore, it is a common misconception that Tadalafil works the same way for every individual. Every man has a unique metabolic rate and a different level of vascular elasticity. While the standard advice might be to take the medication and wait, I encourage my patients to observe how their specific body responds over a period of several hours. Because Tadalafil can remain in the bloodstream for up to 36 hours, it provides a unique advantage over other medications like sildenafil, which has a much shorter half-life. This long duration means you do not have to be perfect with your timing, but you do have to be aware of when your body hits that peak concentration. In the next section, we will delve into the controversial topic of medication quality and why the source of your prescription could be the single biggest factor in whether or not you see the results you are praying for. Understanding the difference between a high-quality pharmaceutical and a subpar generic is essential for any man who is serious about reclaiming his sexual vitality and ensuring that every dose counts toward his long-term success. When you stand in front of your medicine cabinet and look at that small pill, you are trusting that the chemical composition inside is exactly what the label claims it to be. However, one of the most overlooked factors in the failure of erectile dysfunction treatment is the quality and origin of the medication itself. I have seen many patients who come to me frustrated because their prescription suddenly seems to have lost its potency, only to discover that they recently switched to a different manufacturer or a less reputable pharmacy. In the world of pharmaceuticals, specifically for medications like Tadalafil, the phrase "you get what you pay for" holds a significant amount of weight. While generic medications are legally required to contain the same active ingredient as the brand name, the manufacturing processes, the quality of the raw materials, and the binders used to hold the pill together can vary between companies. If the generic manufacturer is not trustworthy or does not maintain rigorous quality control, the effectiveness of the substance can be compromised. For a middle-aged or elderly man whose vascular system is already working harder to respond to treatment, having a high-quality, reliable medication is not just a preference. It is a necessity. This is why urologists often recommend specific well-known brands like Cialis or Xiadin. It is not because physicians have ties to the industry, but because we know these medications have a track record of reliability and consistent absorption in the patient's bloodstream. When a medication has an immediate and significant impact on your quality of life and self-confidence, you want to be certain that the 20 milligrams listed on the bottle actually translates to 20 milligrams of active, bioavailable Tadalafil in your system. The problem often arises with the rise of online pharmacies and international shipping. Many men seeking privacy or a lower price point turn to sources that may not be regulated by the same standards we have in the United States. These subpar medications may contain impurities or, in some cases, inconsistent dosages that lead to a hit or miss experience. If you find that one pill works wonders while the next from the same batch does nothing, you are likely dealing with a quality control issue. A reliable generic should work just as well as the brand name, but the key word there is reliable. I always advise my patients to stick with pharmacies they trust and to be wary of deals that seem too good to be true. It is also important to understand that Tadalafil is primarily sold in two distinct dosage strengths, 5 milligrams and 20 milligrams. The 20 milligrams dose is specifically intended for use on the day of sexual activity and is known for its potent effect. Because it can last up to 36 hours in the bloodstream, the purity of the drug is even more vital. If the medication is poorly formulated, its absorption can be delayed or diminished, leading to a much shorter window of efficacy than the 36 hours you are expecting. This long half-life is one of the greatest benefits of Tadalafil, but it depends entirely on the quality of the medication and how well your body can process it. I once had a patient who had been successfully using a specific brand for over a year. When his insurance changed, he was switched to a different generic, and within weeks he felt his intimate life was slipping away. He was convinced his body had suddenly aged or that his condition had worsened overnight. After we reviewed his new prescription and moved him back to a trusted, high-quality source, his results returned to their previous levels. This story is a powerful reminder that we cannot take the manufacturing process for granted. Your health and your confidence are worth the investment in a medication that is proven to be effective. As we move forward, we will look at how your physical state and even the timing of your meals can further influence how these high-quality medications are absorbed, ensuring that you are getting the absolute maximum benefit from every single dose you take. Timing is perhaps the most misunderstood element of successful Tadalafil use, especially for men who are balancing a busy lifestyle with the desire for spontaneous intimacy. While the medication is famously dubbed the weekend pill because of its long-lasting nature, there is a distinct difference between the drug simply being present in your system and it reaching its peak physiological potential. Many patients have come to my office complaining that the medication is not as effective as it once was, and upon closer inspection, we often find they are taking it far too close to the moment of sexual activity. While the standard recommendation might suggest a 30 to 60-minute lead time, the reality for an aging body is often quite different. To truly maximize the effect, you must understand the window of peak plasma concentration, which is the point when the medication is at its strongest in your bloodstream. For most men, this peak occurs roughly 2 hours after ingestion. I have observed that as we age, our digestive and metabolic processes naturally slow down. This means that a dose of Tadalafil might take longer to transit through the stomach and into the small intestine where it can be absorbed into the blood. If you take the medication and expect it to work in 30 minutes, you are essentially trying to drive a car before the engine has had a chance to warm up. By extending that window to 1 or even 2 hours before the desired activity, you allow the drug to fully distribute through your vascular system. This ensures that when the moment of stimulation occurs, the medication is already at its maximum capacity to inhibit the PDE5 enzyme and support blood flow. It is also important to note that while Tadalafil can remain active for up to 36 hours, its peak effect is generally observed within the first 10 hours after it enters the bloodstream. After this 10-hour window, the body begins to clear the substance more effectively, and while it may still provide some benefit, the surge in potency begins to taper off. Understanding this 10-hour window of maximum potency is a game changer for many of my patients. It allows for a sense of freedom that other short-acting medications cannot provide. For example, if you take a 20 mg dose in the late afternoon, you are perfectly positioned for peak performance throughout the entire evening and even into the next morning. You do not have to worry about the medication wearing off in the middle of a romantic dinner or a long conversation. This flexibility is one of the primary reasons why urologists prefer Tadalafil for men who value a natural, unhurried progression of intimacy. However, the key remains that initial 2-hour buffer zone. If you are rushing the process, you are inviting performance anxiety into the room, which, as we discussed earlier, can physically counteract the benefits of the drug. Furthermore, we must address the difference between the on-demand approach and the therapeutic approach. The 20 mg dose is specifically designed for this on-demand use where maximum potency is the goal. In contrast, some men may be prescribed a much smaller 5 mg daily dose, which is intended to maintain a consistent level of the medication in the system at all times. For the purposes of maximizing the immediate effect for a specific event, the 20 mg dose remains the gold standard. By respecting the biological timeline and giving the medication the necessary time to reach its peak, you are removing one of the most significant barriers to success. In the next section, we will explore another critical factor that can make or break the effectiveness of your treatment: what you choose to eat and drink in the hours surrounding your dose. You might be surprised to learn that a celebratory meal or a couple of drinks could be the very thing standing between you and the results you desire. One of the most frequent mistakes I see in my clinical practice is a patient who takes their medication during a romantic evening that involves a heavy dinner and several glasses of wine, only to find that the results are significantly diminished. While it is a common desire to pair intimacy with a celebratory meal, the physiological reality is that what you put in your stomach can directly interfere with how Tadalafil is absorbed into your system. Many men associate the use of these medications with a night out, but consuming copious high-fat meals can create a physical and chemical barrier in the gastrointestinal tract. When you eat a meal high in fats, think of a heavy steak, fried foods, or rich desserts. Your body prioritizes the complex process of breaking down those lipids. This slows down gastric emptying and can significantly delay or even reduce the absorption of the medication into the bloodstream. This is a primary reason why a patient might feel the medication is no longer effective or that it takes much longer to kick in than it did previously. If you are experiencing issues with the consistency of your results, I strongly recommend trying to take the medication on an empty stomach to ensure maximum bioavailability. By taking the dose without the interference of a heavy meal, you allow the medication to pass quickly into the small intestine, where it can be absorbed efficiently and reach its peak concentration within that ideal 2-hour window. For the middle-aged and elderly digestive system, which may already be slightly slower, this small change in routine can make a profound difference in the potency you experience. It is not that you can never eat before intimacy, but rather that you should be mindful of the timing and the composition of that meal. If you must eat, choosing lighter, lower-fat options can help mitigate the interference with your treatment. Alcohol consumption is another significant factor that can trap unsuspecting men. While a single drink might help some men relax and overcome the performance anxiety we discussed earlier, alcohol is a known vasodilator and a central nervous system depressant. When combined with a medication like Tadalafil, which is also a vasodilator, alcohol can lead to a drop in blood pressure and a decrease in the overall firmness of an erection. Furthermore, alcohol can reduce the absorption of the medication in the gastrointestinal tract, much like high-fat meals do. In my experience, many men find that even a moderate amount of alcohol can dull the sensations and the neurological signals required to trigger the erection cascade. If you feel the medication is failing you, it is worth examining whether your alcohol intake is working against the very goal you are trying to achieve. I often tell my patients to think of Tadalafil as a high-performance fuel for their vascular system. Just as you would not put low-grade fuel or contaminants into a specialized engine, you should not crowd your system with fats and alcohol when you want the medication to perform at its peak. This level of intentionality can be the difference between a frustrating night and a successful one. By prioritizing the absorption of the drug, you are giving your body the best possible chance to respond to the chemical signals of arousal. This leads us to another vital component of success that many men overlook: the necessity of active stimulation. In the next section, we will discuss why the pill is only half of the equation and why you cannot simply wait for the medication to do all the work on its own. Understanding the neurological and sensory requirements for an erection is the final piece of the puzzle in reclaiming your sexual confidence and ensuring that your treatment is as effective as possible every single time. A common and persistent myth that I frequently encounter in my urology practice is the belief that Tadalafil acts as an automatic switch for an erection. Many men assume that once they swallow the pill, they can simply sit back, watch a game, or read a book, and the medication will spontaneously create a result. I must be very clear with you, this is not how these medications function. Tadalafil is a tool that facilitates a physical response, but it requires a biological spark to initiate the process. An erection is not just a localized event in the body. It is a complex neurological and sensory journey that begins in the brain. Without the necessary excitatory stimulation, the chemical cascade required to relax the blood vessels simply won't be triggered, regardless of how much medication is in your system. In the medical world, we refer to this as the need for sensory input. This means that for the medication to maximize its effect, you must actively seek out what makes you feel aroused, whether that involves touch, smell, or visual stimulation. Think of Tadalafil as being like the fuel in a car. The fuel is ready and waiting to provide power, but someone still needs to turn the key in the ignition to start the engine. That key is sexual stimulation. For many middle-aged and elderly men, the threshold for this stimulation can change over time. It may take longer to reach a state of arousal than it did in your younger years, and that is perfectly normal. However, if you are taking the medication and then waiting passively for it to happen to you, you are likely to be disappointed. You must engage your mind and your senses to signal to your nervous system that it is time to release the nitric oxide that Tadalafil is designed to support. This neurological component is why your mental state is just as important as the physical pill. If you are distracted, stressed, or not feeling particularly connected to the moment, your brain may not send the strong signals necessary to start the erection cascade. I often encourage my patients to focus on the sensory experience and to communicate with their partners about what feels best. This active participation does not just help the medication work. It also helps to reduce the performance anxiety we discussed earlier. When you focus on the pleasure and the connection rather than the success of the pill, the body tends to respond much more naturally. Remember, the medication is there to enhance the firmness and rigidity for sexual activity, but it cannot create the desire or the initial arousal for you. Furthermore, it is important to understand that the physiological process involves the release of specific chemicals in the penile tissues that Tadalafil then protects from being broken down too quickly. If there is no stimulation, those chemicals are not released in the first place, leaving the medication with nothing to work on. This is why some men mistakenly believe the drug has stopped working when, in reality, they simply have not provided the necessary spark. By combining the pharmacological support of a high-quality 20 mg dose with intentional sensory stimulation, you are creating the ideal environment for success. As we move into the next section, we will discuss how choosing the correct dosage strategy, whether daily or on demand, can further tailor this experience to your specific lifestyle and health needs, ensuring that you are always prepared when the moment is right. Choosing the correct dosage strategy is perhaps one of the most vital decisions you will make in your journey to reclaim your sexual health, as it dictates not only how you plan your intimacy but also how the medication interacts with your long-term vascular well-being. In my clinical experience, many men are confused by the two primary ways Tadalafil is prescribed: the 20 mg on-demand dose and the 5 mg daily dose. Understanding the difference between these two is essential for maximizing the medication's effect. The 20 mg dose is specifically designed for use on the day you anticipate sexual activity. Because this is a much more potent concentration, it is highly effective at providing a significant boost in blood flow and firmness, often lasting up to 36 hours in the bloodstream. This is the maximum effect dose that many men prefer when they want to ensure they have the highest possible level of the active substance during a specific window of time. However, it requires the most attention to the timing, meal consumption, and stimulation factors we have already discussed. On the other hand, the 5 mg dose is intended for daily treatment regardless of whether you plan to be active on that specific day. Many patients mistakenly believe that a 5 mg dose should have the same immediate impact as a 20 mg pill, but that is not how it works. The daily regimen is about building a steady, consistent level of the medication in your system. This approach can be particularly beneficial for middle-aged and elderly men because it helps maintain a constant state of vascular relaxation, which can actually improve the health of the blood vessels over time. It removes the pressure of planning for a 2-hour window and allows for more natural, spontaneous moments. However, for those who feel the daily dose is not giving them that extra boost they need for peak performance, the 20 mg on-demand dose remains the most indicated option for maximum potency. It is also important to mention sildenafil, often known as the little blue pill, which comes in 25, 50, and 100 mg formulations. While it is a similar type of medication, Tadalafil's unique benefit is its longevity. Every patient is an individual, and what works for one man may not work as effectively for another. This is why I emphasize the importance of adapting the dose to your specific situation. If you find that the 20 mg dose is causing too many side effects like a headache or back pain, but the 5 mg dose is not quite strong enough, you should consult with your physician about finding a middle ground or adjusting your timing. We must also recognize that as we get older, our bodies may process these dosages differently than they did even 5 years ago. For some men, even after optimizing the dose and following every tip, they still feel they are missing that final piece of the puzzle. This is where we look toward more holistic approaches and alternative rituals that can support the body's natural ability to restore potency and confidence. It is never just about one pill. It is about a comprehensive strategy for your health. If you feel like the medication is no longer doing the heavy lifting, it might be time to reevaluate your overall lifestyle and look for natural ways to boost your desire levels alongside your medical treatment. As we move into our final section, we will wrap everything together, focusing on how to build a sustainable and confident path forward so that you can stop worrying about the mechanics and start enjoying the connection and intimacy you deserve. Reclaiming your vitality is a marathon, not a sprint, and with the right dosage and mindset, you are well on your way to a more fulfilling life. Building a sustainable path forward in your intimate life requires a shift in perspective, moving away from viewing a pill as a crutch and towards seeing it as a valuable partner in a larger wellness strategy. For many men in their later years, the anxiety surrounding performance can become a self-fulfilling prophecy, but by implementing the strategies we have discussed, you are taking back control of your narrative. We have explored the importance of choosing high-quality, trustworthy medications to ensure you are receiving the potent 20 mg dose your body requires. We have addressed the physiological necessity of taking Tadalafil on an empty stomach and avoiding the interference of high-fat meals and alcohol, which can significantly hinder absorption and reduce the clinical effect. By adjusting your timing to ensure you are within the 10-hour peak window and allowing at least 2 hours for the medication to reach maximum concentration, you are respecting your body's natural pace. Most importantly, we have debunked the myth of the automatic erection, emphasizing that sensory and neurological stimulation are the essential triggers that turn the key and allow the medication to work its magic. If you have followed these steps and still find that you are lacking that extra boost, it is important to remember that erectile dysfunction is a prevalent condition that affects a vast number of men as they age, and there is no shame in seeking further refinement of your treatment plan. Sometimes the answer lies in exploring natural alternatives or home rituals that focus on restoring your body's innate potency and desire alongside your medical regimen. This holistic view ensures that you are not just treating a symptom, but nurturing your overall confidence and vitality. Your journey toward better health is personal, and by being proactive, informed, and patient with your body, you can overcome the hurdles that once seemed insurmountable. The goal is not just to have a successful night, but to foster a lasting sense of self-assurance that permeates every aspect of your life. As we conclude this deep dive into maximizing your health, I want to thank you for being an active participant in your own care. If you found this information valuable, please consider sharing it with someone who might be struggling in silence, and do not forget to subscribe to our channel for more weekly insights into senior health. By staying educated and open to these clinical tips, you are choosing a life of connection over a life of frustration. It has been an honor to guide you through these medical truths today. The path to reclaiming your vitality is within reach when you pair modern medicine with the wisdom of your own body's needs. Take these steps to heart, breathe through the pressure, and remember that you deserve a life filled with confidence and joy. You have the power to transform your experience, starting with the very next choice you make for your health.